So I'm going to go over dental charting for dental assistants, and I'm going to first go over some basic navigation type issues, and then I will go over actually how to do the dental charting. So when you're in Eaglesoft and you have selected a patient, you can select a patient just by clicking on their appointment like this. Then you're going to go to this icon called Chart or Open Chart. When you're a new assistant, it might be set up in your office to just show these icons. If it is easier, you can click on this toolbox and click Show Text on Unscheduled Toolbar and Show Text on Activities, and then it'll have the actual name underneath the icon. So in this example, we're seeing a patient called Test, and we want to open up their dental chart. This can be called, this area here is called the odontogram. This portion down here is called the ledger, and then over here are your images. So sometimes you might see this area blank. That's just because we've selected or deselected the ledger. The same thing over here, you might have seen or not seen the images. You can just click over here and you'll see that. Okay. So when we open up the chart, there are a couple of other areas that allow us to get into the images. Sometimes you're going to just double click on the actual image and it'll open up the image like this. Another way to get to the x-rays is simply by going to this, what I'm going to call a down triangle, and then you're tempted to click on digital x-ray, but really that is to open up a new template. What you really need to do is click on view images, and it'll bring you to this screen where you can select a new bite wings or a new panoramic x-ray. Okay. The other thing that is important is on this menu, you can also open up the patient's perio chart here. If the doctor or the hygienist wants to see past numbers, you're going to go here and go to comparison. Okay. So as far as the dental charting goes, obviously you can see all of the teeth numbers. And when you have a new patient, this is what it's going to look like. Now, it is possible, or it might be required when you have a child, that you want to switch all of these teeth to primary teeth. So you have a couple of buttons here where you can select different teeth. So if I want to select all the teeth, you can see when I click select all, they have this brown background. That means that those teeth are selected. You can also select all of the upper or all of the lower, or you can clear all of them. So that's kind of a shortcut for that, okay? So if we wanted to switch all of these to primary teeth, we would click select all, and then we would use this primary button here. And you can see all of these teeth are the primary teeth, which are designated by letters instead of numbers with the adult teeth. Now, if you have a younger person who is in what's called a mixed dentition, the provider might ask you to switch the teeth. So, for example, they might have, let's just do an example here. They might have their adult front teeth, let's say the front 4 teeth. The provider might ask you to switch these teeth to their permanent teeth, and you can see that it'll switch just those teeth. So one important aspect is when you select something, just be cognizant that if you select just one tooth, that's great, but you might need to select multiple teeth. And that's also important when you're also adding in any of these diagnoses. I can select one tooth and select permanent. I can also select 2 teeth and select permanent, and it'll change both of those teeth, okay? So in this case, we're going to select all of the teeth and put them as permanent teeth. Now, also with providers have been trained so that when they do their diagnosing, they're going to read off tooth by tooth. So you're going to always start up here at the upper right, which is tooth number 1. You're going to go through 16 or the upper left, down through 17, the lower left, and then to the lower right. Okay, so an example would be they're going to read off a diagnosis. So number 1 is a wisdom tooth. Now on wisdom tooth, I'm going to start going over some of these, what I'm going to call buttons, which are these buttons, these main buttons out here. So periodical exam, new patient adult prophy, SRP, a composite anterior, and then below there are, with using the down triangle, are I'm going to call these CDT codes, okay? So a CDT code are these numbers or these designations that start with the letter D, okay? Now, there's a difference between CDT codes, which start with D, and these other codes, which are what we call exploding codes. So what are exploding codes? Exploding codes are a group of CDT codes that we use commonly together, okay? So for example, a recall patient adult prophy would contain 3 or 4 different exploding codes. And you can actually see what your exploding codes are by going to lists, exploding codes. Okay, so here's the list of all of the exploding codes. For example, SRP4 includes 4 quadrants of this service code or CDT code called periodontal scaling and root plating, or D4341. Okay, so back to our chart. You can see in the main button group of SRP, there are CDT codes, and then there are exploding codes. Okay, so it's important to kind of go through all of these, okay, and understand exactly what they are. So for example, let's go ahead and go through the main button groups. Periodical exam is just your D0 120. If you hover over it, you're going to see that it designates exactly what it is. NPAP, this is an exploding group or exploding code, and the main button points to that. And SRP is just a D4341. This is a composite anterior. Super important to understand which teeth are anterior teeth. So anterior teeth are all of these teeth, whether it be in the primary dentition or the permanent dentition, that are the canines or anterior to those. So you can see it's 6 through 11 and 22 through 27. Those are the anterior teeth on the permanent dentition. On the primary dentition, it is C through H and M through R. Okay, so that is super important to understand, because unfortunately in Eaglesoft you have to select between an anterior tooth and a posterior tooth when you're doing composites. Okay. This bridge is a bridge anterior, okay, or excuse me, it's not a bridge anterior, it's a bridge abutment, meaning for dentistry, if we have a missing tooth here, and we're going to put a bridge that hooks onto these abutment teeth, these would be the abutment teeth. And the pontic tooth, this is bridge P, is the tooth that is the fake tooth, okay? So it's important to understand this is composite anterior, this is not bridge anterior, this is bridge abutment. This is composite posterior, this is bridge pontic, okay? I understand it says P and A, but they mean different things, okay? So this is a crown, this is a root canal, okay? This is a denture. This is sedation. If you're doing oral surgery, you would use this. A lot of times under the general practitioner, you're not going to use that. This is a surgical extraction. This is not a simple extraction. This means surgical extraction. These apico, this is a lot of stuff that you're going to use if you are working with an endodontist. If you're with a general practitioner, you're not going to use this. Bite wings, 4 bite wings. This is new patient child prophy. This is an amalgam. We do not usually place amalgams, but a lot of times we're going to encounter amalgams or the silver fillings. Like we said, a composite posterior, bridge, pontic, a buildup, retreat of a root canal, again, this is only going to be used if you're working with an endodontist. This is an RPD, or a partial denture. This has a lot of miscellaneous codes, for example, some of the medicines that we sell. Implant would be for a lot of the implant codes here, okay? And ortho, the only thing that you would really be using here for a general practitioner would be this occlusal guard, or potentially an ortho retainer, which is this orthodontic retention, okay? So it's important to know kind of these main buttons, selecting all upper left, upper right, primary and permanent dentition. And then the other two things that you need to know are impacted or missing teeth, okay? So the first thing usually that you're going to do when you start charting is you're going to chart the missing or impacted teeth. The reason that that's important is it eliminates those teeth off of the periodontal chart. So for example, let's say that we have all of our wisdom teeth are impacted. We would select all four of those, make that designation. You can see this little circle around that tooth. That means that it's impacted, meaning it's underneath the gum. Let's say that this patient also has a missing tooth, number 2. You will select that, and you can see that that grayed out tooth is a missing tooth. The nice thing is after we save this and we go to their periodontal chart, you can see that in red, all of the impacted and the missing teeth are no longer needing to be charted. Okay, so that's super important. Now, when you're going to chart, it's important to kind of follow the provider and see what exactly they want. Okay, for example, if we want to chart, they're going to read surfaces on teeth. Okay, so let's say that we want to chart a filling on number 3 that's needed. Okay, now when you bring up the diagnosis here, and remember, we know that tooth number 3 is a posterior tooth, so we're going to click on composite posterior. Now, if we come up here to the status, there's going to be proposed or existing. So proposed are things that people need. Existing are things that people already have, okay? So it's important to know that. And the last designation that we use, so for example, if I put proposed on tooth number 3, then every other tooth that I choose from now on is going to use proposed until I change it to existing, okay? So I'll show you an example of that. So let's say that the doctor is saying, this patient needs a DO on tooth number 3. So you're going to choose proposed. Now, this response here, sometimes it's going to be, if your provider uses walkouts a lot, this might be changed to walkout. Now, walkout is actually going to be in a different color than proposed. It's going to be purple instead of red. So it's important to kind of investigate that right here. Okay, so I'm going to put this to proposed. And the doctor is going to usually, or the provider is usually going to use a designation that is the first letter of these surfaces. So it's important that you understand the surfaces. So the mesial surface is the side closest to the midline of the mouth. The occlusal surface on a posterior tooth is the biting surface. The incisal surface on an anterior tooth is the portion closest, or the portion that incises or bites on the piece of food. So it's essentially the biting surface of the tooth, okay? The buccal is the portion right on, or it sometimes is called facial, is the portion up against the cheek. Sometimes there are different classifications of buccal, which are next to the cheek, but also next to the gum line. Those would be called buccal or facial class 5s, okay? And the same thing would be on the lingual surface. It would be, the lingual surface is the surface next to the tongue. A lingual class 5 would be next to the tongue, but also next to the gum line, okay? And so most of the time you don't need to worry about these class 5s. You can just use the buccal or lingual unless your provider designates that it needs to be class 5, okay? The distal is the side of the tooth that is farthest away from the midline or furthest to the back of the mouth, okay? So, for example, if we are going to do a proposed, it is, and it's going to be on the MO or the mesial occlusal. Again, the doctor might read this off as an MO. You're going to click proposed, MO, and you're going to select that with your mouse, and you're going to click OK. Okay, so it's important, and you will be corresponding with this portion of the manual that's called dental charting, that you need to understand all of these different colors on the odontogram and what they mean, okay? And our legend is down here. So red equals proposed, blue is an existing condition or an existing dentistry, essentially. Green is completed, purple is in the walkout queue, orange is referred out, yellow highlighted is a watch, a gray circle is an impacted tooth, okay? Gray tooth is missing, and a blue X means an existing extraction. An existing extraction is a little bit different than a missing tooth in that the patient originally came to our office with a tooth and then they came back and that tooth was missing. They might have had it removed by another provider outside of our office. So it's important to understand those designations. So you can see in this sample odontogram, this patient, this would be needing a denture. This one here is had an existing extraction. This one needs a crown. This one, we completed an occlusal filling on tooth number 4. They came in with an existing filling on number 3. Number 2 needs an extraction. Number 31, so this orange color is we're referring out for a root canal. This 30 occlusal, this purple color, is it's in the walkout queue. This 29 has a watch. Okay, so that's that red, that yellow color behind the tooth. And then you can see there's a primary tooth here. These gray ones are missing teeth. Okay, so it's very important to understand this little legend that we have down here. The other thing that's important for you to do is to get well versed on looking at these panoramic x-rays. And so when you're brand new, it's important to go in and start looking at these and start identifying with providers what these materials are. Because as you become more experienced, it would be nice to understand all of these different dentistry in patient's mouth and potentially even have them charted, the existings charted before the provider walks in. If you really want brownie points, that's what you really need to get to. So you can see example, there's a missing wisdom tooth here. This right here is a crown. This is a root canal. This is a silver filling or an amalgam filling, and it's different than a composite filling. It's going to look a lot more white here. And here's another crown. So get really good at identifying all of the different structures on the panoramic x-ray. As you get better, you should even understand where the sinus is, where the inferior alveolar nerve is, where the different jaw bones are, and things like that. So practice all of this and read through this portion of the manual and work with your provider to get very good at understanding that panoramic x-ray. So back again to the odontogram or to the charting. So for example, the provider is going to say we need a filling on number 3. We need an MO. So we're going to chart that. Then they might say that we have an occlusal on number 4. So we would click on number 4, and then we would say that we have one, so it's a composite posterior. But do you see that it's still under the proposed? So we would go under existing here and then click on occlusal, and we expect it to show up in blue, which it does, okay? Now the secret here is that, let's say that we have both 5 and 6 need biting surface fillings, okay? The issue is that 5 and 6 are different buttons here, okay? So 5 would be a posterior tooth, and it needs an occlusal, and we would need to click here to proposed, because remember the last one we used was existing. And then number 6 would be an anterior tooth that would need an incisal. Okay. Now, the doctors are trained that they should actually pause in between both of these and say, so 5 is going to need a posterior occlusal, and then they're going to say N6 needs an anterior incisal. That way you don't select both of these, because it is possible, for example, to click on 7 and 8. If they both need incisals, I can click on composite anterior and click on incisal proposed, and you can see that it'll be correct for both of those. So you can select multiple teeth. So for example, if 12, 13, and 14 all need root canals, you can click on root canal for all 3 of those. It's proposed, and we can click on OK, and it's going to come up and it's basically going to say, oh, there's another one, there's another one, there's another one. You just click on OK, 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 and it'll go through that. That's very common with when you're choosing SRP times 4. So if you're going to be doing an SRP, so an SRP is into different quadrants. You're going to go upper left, OK, or excuse me, upper right, OK, upper left, OK, lower right, OK, and lower left, OK. And it'll chart all of those, okay? So it's very important to go through all of these button groups to understand what they mean and what they're used for, okay? So as we're going through all of these, it's important to, so for example, number 15 needs a surgical extraction. We'll click on this, click on proposed, click OK. 16 is impacted, 17. Now let's say that these impacted teeth need to be extracted, and they need to be extracted with full, and the diagnosis is full bony extractions or completely bony. So you would go down here to the drop down, and you would go to completely bony. You'll click on that, and you'll select proposed, and you'll click OK, and you'll see all 4 of those wisdom teeth will be needing to be extracted. Now, again, as you get better, it would be advantageous for you to understand the difference between what a simple extraction is, a surgical extraction, a partial bony extraction, and a full bony extraction. In general, the canine teeth and posterior are usually going to be surgical extractions, which is this main button. The anterior 4 teeth, which is 7, 8, 9, and 10, and 23 through 26 are usually going to be this D7140, which are simple extractions. Again, if you want to take yourself to a higher level, you would understand the difference between a simple extraction and surgical extractions. And then another thing would be is to understand what these numbers are. So your experienced doctors are going to know that a surgical extraction is a D7210, and the simple extractions are D7140s. So a lot of times doctors, as they mature in their career, and assistants when they mature in their career, they go off of the CDT codes instead of even the descriptions because it's shorter for them. So again, need to super understand all of these buttons. You need to understand which of these other CDT codes are underneath each button, and then get very versed, because as an experienced doctor, you're going to read off a lot faster these codes than a brand new assistant is used to. So for example, an experienced doctor might read it like this. So number 1 is going to need to be extracted. That's a full bony extraction. Number 2 is a missing tooth. Number 3 needs an MO. Number 4 it has an occlusal composite. Number 5 needs a posterior occlusal composite. Number 6 needs an anterior incisal composite. Number 7 and number 8 need anterior incisal composites. Number 9 is looking good. Number 10 is looking good. And the doctor is just designating that those teeth do not need anything. Number 11 is looking good. Number 12 is going to need a root canal. Number 13 is going to need a root canal. Number 14 is going to need a root canal. Number 15 needs to be extracted surgically. Number 16 needs a full bony extraction. Number 17 needs a full bony extraction. So that kind of cadence or that speed is what you need to get used to. And so if you watch some of the more experienced assistants, you're going to see them clicking through the odontogram and the charting mechanism to be able to chart that almost at that speed. So it's very important to get very good at this very quickly, because you want to be proficient in front of both the patient and the providers in getting this this charting mechanism, so that we can, as the providers, we can read it off very quickly, and we don't have to pause and have you correct things. Now, when you do need to correct things, there's a couple of ways to do that, okay? The first way was, let's say that the doctor made a mistake, or you made a mistake, and you charted 8 as an incisal when in reality it needed to be an incisal lingual. The easiest way to do that is just to right click on that tooth and go to Edit, and then we go to Anterior, or we go to this filling that we had previously treatment planned. So Edit, and you can see there's 2 things that are needed on this tooth: the filling and the deep cleaning. So we're going to choose the filling, and then we can simply just come in here and choose the additional surface, okay? And we can choose lingual. So now you can see that the surface has changed to lingual. The other ways that you can do this is, let's say that it was accidentally, we made a mistake and put it as proposed, but it just needs to be existing. We can change that here too, okay? So that's super important. Now, sometimes you have different different diagnoses that could cover each other up. So for example, let's say that I put a crown on here, and I also put, let's say, an extraction here, okay? Let's see. Let's say that we put, let's say that we had, just for argument's sake, let's say that we had a partial here, okay? And do you see how that partial covers up the crown? You can right click here, bring to top, and you can bring the crown up, okay? So just understand that you can bring things forward. Okay. We also talked about watches. So if you want to add a watch to this tooth, you would click on Add Watch, and then you would put a comment here. You could put, there's a watch on the incisal, or you could put frac on facial, and you could put this on here, and you'll see that that will, after you deselect it, that there's yellow in the background, okay? So that's how you add a watch. The other thing that you can do, so for example, if I mistakenly put this partial here, I could come in here and I could also delete it. Okay, so I'm going to go ahead and delete that partial. Okay. Now, when we're charting partials or dentures, usually we're going to just select one of these teeth up here. So if I click on tooth number 1, I'll click on denture there. And down here, the reason why is if I just select denture and I put it on the lower arch, you're going to see it's going to cover everything up. So if I made a mistake and did that, I'm going to right click and I'm going to go Edit, and I'm going to go the complete lower, and instead of the lower arch, I'm going to deselect the lower arch, and I'm just going to click on 32. That will allow me to see the entire dentition without covering it up, but I know that I have that. And that's important to do even with existing dentures. So if this patient came in with an existing denture, I'm going to click on Existing, tooth number 2, and I know that we have an existing denture and we need a new denture. So important to go over all of those things and just practice, practice, practice. And you're free to pull up any of these test patients and just kind of go through an example with one of your experienced assistants or one of your providers in getting all of these charted as quickly as possible. So that's our video on charting. Again, practice makes perfect, and talk with your doctor or your hygienist or your experienced assistants on how you can get up to speed on all of these items that we discussed today.